Welcome. Welcome to another episode of Everything is Public Health. It's brought to you by Young Health Professionals. I'm one of your co-hosts, Mr. Murray. I have my other co-host, Dr. Linda Ray Murray. And today we're going to be talking about where do we go from here with our two special guests, Selena and Jim. So, Jim, we always let ladies go first. Selena, please introduce yourself.
Good evening. Good evening. My name is Selena Smith. I am the Senior Associate Director at the University of Illinois at Chicago's Urban Health Program, where we have been around for 42 years, fighting the cause, supporting our students, trying to make sure that all students of color, African American, Latina, Native American will successfully complete the health sciences and become practicing health professionals. Thank you for having me this evening.
No problem. Brother Jim.
Mr. Murray, appreciate it so much to be here with you guys. Thanks so much. My name is Jim Bloyd, recently retired. In fact, this is my middle of my third week of retirement from the Cook County Department of Public Health. I'm super excited. I'm really, really happy, and I have a lot of plans, some of which are going to come to me as I work forward. But I'll be finishing my dissertation, which I'm real excited about, the revisions. And I'll be continuing to provide leadership to the Collaborative for Health Equity Cook County, and hopefully to other efforts fighting for social justice and against racism going forward.
That's good. Jim, I'm thinking about going back to school. You're never too old to learn, brother.
That's
I'm
right.
Definitely thinking about it. So
Absolutely.
Before we get started, I have a question for both you and Selena. You got tickets to a game. You can only go to one game. Which game are you going to choose, the Cubs or the Sox?
The Sox.
Jim?
Go Sox.
Cubs.
All right. I love Chicago team.
Biases already, Marcus.
But I'm a Cubs man all the way.
Yeah.
Yeah. Oh, go ahead, Jim.
No, I just, every time I think of that question on your guys' show, I have memories of ditching school with classmates to go to opening day.
I'm going to be honest with you. High school, I wouldn't ditch school to go to either stadium. I'm definitely not going to Bridgeport, and I definitely wasn't going up to Wrigley Field. You know, I might not make it back. So, you know, I'm a fan from WGN. So,
gotcha.
You know. Doc, what's going on? You got some wisdom you want to start us off with today?
Well, I want to say one commercial event. If you are considering what to do next week during Thanksgiving, please eat with only the people that live in your house. I have a whole community that we usually rotate Thanksgiving around. We take turns year by year, and there are probably 20 of us that are involved in this, and we're doing what we call a drive-by Thanksgiving. Everybody's getting their little dish that they usually bring, and one of us is going to drive through the community and pick up everybody's gifts, dish of food, and then reverse it and drive back and drop off the bags. So please be careful because it's dangerous out there.
Well, make sure you ain't doing the driving. You know, let some younger person do the driving. Is Willie going to send some of his famous Willie rolls?
To me, yeah.
I make sure I drive by as well. So start us out, Doc. Where do we go from here? What's going on? What's your thoughts?
Well, I think the important thing that we want to talk about today, and I just brought up some of the exit poll information, is what's going on with these elections. You know, we had a lot of discussion and debate, especially among young people, especially in communities of color, about the importance of voting, who was going to vote, who wasn't going to vote. So now we had this election, and the latest figures I've seen is there's a 6 million vote spread between Biden and Trump. And I think one of the things that should not surprise us is the results of the election. Of course, the final result is one thing, but also when we break it down, it's not much different than we should have known as we went along. So we know most white people voted for Trump. And we know that about a third of Latinos voted for Trump, and about 10%, 8 or 10% of Blacks voted for Trump. But what I really want us to ask, I wanted to ask everybody here, is okay, Biden is going to be president January 20th. What should we be doing between now and on the 20th to make sure something good happens?
Me personally, I think we need to, so we voted. We got our young people out to vote. We got our elders out to vote. We got people who had probably never been to the polls ever out to vote. Our voices were heard. So we did the thing. And, now it's time to, make some things happen. We won the House. We have a Democratic president. And so hopefully many of the things that were done wrong in the past 4 years will be fixed or overturned. But we can't stop here. We have to encourage people to vote at the midterm, because that's going to make some critical decisions as well. It's the Senate, as it relates to the Senate and the House, you can't stop there. But we also have to be in tune with our public officials, our legislators, our congressional members. We have to make sure that we push our constituents to do what we need them to do. To just stop at voting is oftentimes the thing that we do most wrong. We vote and then we expect miracles to happen. It's not going to happen that way if you just vote and then go sit back in your corner. You're going to have to get a pen out. You're going to have to get some paper, write some emails, send some letters, make some phone calls. I learned this at an early age. My grandmother was a staunch advocate. It didn't mean anything for her to hear something on the news that she didn't like and put her pen and paper to work and write the congressman or write the president. She sent many letters to Washington, D.C., and she got results. They read her letters and they responded to her. So I think the message that we need to send is that, we can't stop here. You have to tell people what they have to do next, because if you don't, they're just going to sit back and do nothing and expect everything to just happen. We told them to go out to vote. We were spot on with our message. This needs to happen. And what happened? Based on what people saw, they didn't like what happened the last 4 years, and they got themselves out there to the polls. So, we have to be strategic, not mad, but strategic, and get out there and get the message that we need communicated to our constituents, the people that we put in the office.
Jim?
Yeah, I absolutely agree with Selena that voting is just one important, but one part of a struggle for social justice, health equity, and a better society without white supremacy. So I think one thing I've been really reflecting on, looking at these results with the majority of white people, with no gender gap between white men and white women, voting with an increased number for Trump, even after 4 years of his racism and misogyny, and attacks against working people and immigrants and faith minorities. I think it's really important for white people to challenge and confront other white folks who really haven't made that connection. I'm not exactly sure, how I will do that, but I'm sure I can be creative, and it must be a job for all of us to expand the number of the job for white people to expand the number of woke, if you will, white people. But also, I think one thing from a public health leadership perspective, I think public health movements in the streets, health equity movements, those of us who actually think about theory and practice, we've got to support a deepening of public health connections to community and to social movements. Movements such as, I've been seeing some things on Twitter about folks organizing in Chicago to stop the impending disaster and potential waves of evictions, for example. I find it really troubling to read that groups like Good Kids Mad City, who hand out free PPE and other necessities on the streets, are saying, you know, in their tweet that we're doing more than Lori Lightfoot's doing. And that's something I'd like to follow up with you all and find out what your opinions are on that. But I think it's really important for public health folks to show a real commitment to connection to the exploitation and oppression that's going to continue on, even under a new president.
So let me throw this out there. So both of you all made some excellent points. One of the things that I'm hearing on the street, you know, from some of my colleagues, what they're hearing is this fight against Trump and white supremacy, you know, and that's what this vote was about. And to me, that's a concern. Like, we knew white folks been racist since the beginning of the time. I was raised similar to how Selena was in terms of her grandmother teaching her, we have to hold these politicians accountable. So even with your thing, Jim, with Lori Lightfoot, one of the things we have to do, the Trump thing is over, man. We really need to be focusing on these local aldermen and state reps that can implement some of these policies and changes. And if you don't get up in their face, they ain't gonna do nothing. They're gonna say there's no reason for them to do anything. You know what I'm saying? So what do we need to do on a practical level? Like, what are some strategic things we could do to help young people organize where their voice is heard on the, you know, more on the local level?
Well, I think it's important to understand that the local, state, these levels are all connected. I agree with you that, you know, there's a saying in politics, all politics is local. So I certainly think that the local level is critical. But I also think that we have to be able to understand the connections up. So let me just, before we leave the federal election, let me just point out that this country is divided. The reality is that the Democrats, I'm not going to say us, but the Democrats lost ground in the House of Representatives. They still have a majority, but they lost ground. And if they don't win these two seats in the special election in Georgia for senator, they won't have the Senate, which means that the Biden administration will really be hamstrung. But we have to remember what Stacey Abrams has been talking about. We have to look at first the Electoral College. That is something that I've never liked since I was a little girl and they were teaching us about it in school. That's going to take a while to get rid of that. But that is one of the major reasons that one person, one vote doesn't exist in this country, because my vote in Chicago is worth a whole lot less than somebody voting in Wyoming. So that's one thing. The second thing is, even on the local level, we can't function locally without understanding the national too. So the fair tax, we haven't talked about that. The thing that would change the constitution of the state to tax rich people more. Basically, the rich people had the money. If you want to get money from taxes, you need to tax them more. And that failed. And so that means that the amount of money that's going to go to schools, the amount of public schools, the amount of money that's going to go to the universities is going to be less. And we have to be sensitive to that. And it's important that we understand that. So the Pritzker, the governor, is not going to be able to do too much if the federal government doesn't have a better CARES package for this COVID, and the county and the city are not going to be able to do much if the state doesn't have more money. So all these things are connected. It's easier to get in the face of the aldermen, and so we should do that because they're here all the time. But we really need to get in everybody's face and force them to work together.
I mean, even on some local levels, though, you know, in terms of seeing some type of immediate change, I don't want to lose the momentum we have of the young people in terms of not going to the aldermen and state reps. You know, I just really want that energy to keep going.
Well, one thing maybe I could connect this with is with both Selena, especially, and I know you, Linda, are working at UIC in different capacities. And one of the results that I read, as far as the fair tax not passing, was a real potential devastating effect on the budget for higher education. And so, Selena, I was thinking, as you're talking, Marcus, is in terms of organizing young people, either in high school or students who are in the university now, about these cuts. And I'm wondering if you're hearing things like that, Selena, and maybe if those things suggest some collective action in terms of doing political education and action kind of organizing work.
Well, so at this point, there hasn't been a discussion as of yet about the cuts that are to come and how the not passing of the Fair Tax Act will, the implications that it will have on the university. At this point, we do know and we do expect that there will be some hardship that we will undergo as a state institution just because of the way the state budget has been decimated as a result of the pandemic. What I wish had have happened, in retrospect, is that we had have clearly educated people. Maybe we should have done some Zoom town halls to educate people on what the Fair Tax Act was, because I suspect that people went to the polls and just didn't vote either way. Just like you do when you see the judges on the ballot. You don't know the judges, but you just don't do anything. And then you wind up having a slate of judges who won't rule anything in your favor, as it relates to minorities. But what I did for my family, my daughter and my son, we looked up every judge that was on the ballot and what their voting policies were. I mean, it took some time for us to do, but we did it. And this is a practice that I hope that she will carry, from here on out. So as public health professionals, we have to take some ownership in educating people and making sure that people know what they need to know. When it comes down to the university, the fight that we're having is trying to make sure that students get money to go to school. Many times the few students that are accepted, the few African-American students, which is the one population, let me be clear, that is still not in double digits at the university. We're like,
wait, say that again. So people want to, please repeat that stat again.
Oh, repeat the fact that African-American students are at like 8 or 9%. I think it's about 8.3% at UIC. Yeah. The Hispanic population, I think, is around like 31, 32. So we're not doing well at all, but they want to say that, we're having one of the best years ever. I don't want to hear that. Talk don't care who do it because it's free.
So,
I'm sorry, Selena. I was going to point out that when I was an undergraduate student at UIC, the percent of Blacks in the liberal arts, the largest college there, was 22%. And today it's less than 8%.
Yeah.
So that's what I'm saying. I'm glad you all brought that up. That's the momentum I'm talking about. Now, Jim, you family, I want you to hear this. You family. I respect Jim for saying he's going to speak to white folks and try to help white folks out. But for me, one thing I learned over this past 4 years in this election and seeing the way Black folks united, I'm going to start putting some pressure on us. I'm going to start putting some pressure on some of these Black administrators and recruiters. Not you, Selena. I know what you do. But like, help some of these brothers and sisters get in school. Like, we have to depend on us to figure out where do we go from here, and then partner with the white folks like Jim and them and other races. But we have to do it. The onus is on us. If we don't step up and we wait for for the sake of this conversation, some white angel to come down and give us what we need, man, that's some BS. We got some powerful Black people in all type of positions that we need to put some pressure on them as well. Because the fact we're not getting these little kids educated is a damn shame.
It is a shame. First, I wanted to remind people that if you're on Facebook and you type some comments in or questions in and we can't see them, and I want to acknowledge Maddie Bogan's been going here and wants us to talk a little bit about mental health, which we'll get to in a minute. But I want to say this. So go back to the fair tax. The fair tax won in Cook County. It won by 75% in Cook County. So you could argue that Black people and other people of color did their job locally. But the critical thing is, we have to bring. It's not about asking for stuff. We have to, or even demanding things. We have to change the structure that allows these things to happen. So, for example, the way we finance education in the state of Illinois is backwards. We use property tax. So it's not enough just to say, don't close our schools. That's important. Or give us more money. First of all, we shouldn't even say those words because it's our money to begin with. So that's the first thing. You know, they're not giving us anything. This is money. And if you consider all the money they stole from us over the centuries, that's a whole nother question. So they're not giving us anything. That's money that our families paid into the tax system. So what we have to say is, no, we want that money and those resources distributed in an equitable manner. And the first way to do that is to get rid of property tax as the basis on which schools are funded.
Exactly.
So to me, we should look at the same thing when we're talking about admissions to college. We know, for example, this has been known for years, that the way to predict how well someone is going to do on the ACT or SAT is just to look at how much money their parents make. That's the closest correlation. The more money the parents make, the higher the score is. Then it's not related to grades or anything else. And so we should ask ourselves, why are we using SAT and ACT to allow people in college? It doesn't predict how they do in college. It doesn't predict how they do later on in life. The same thing with the exams we have for medical school. We know that the MCATs, which is an entrance exam you take in order to get into medical school, has absolutely nothing to do with what kind of doctor you are at the end. And so why do we allow that? So what's happened is, in order to stay in power, these white racists or white supremacists have invented, just like we used to have laws where you had to guess how many jelly beans were in a jar before they let you vote, or you had to prove you could read something before they let you vote. We have all of these obstacles that are put in the way that have nothing to do with one's ability to go to medical school or to graduate from high school. And we allow those false barriers to exist instead of attacking at the root and saying you should not be educated based on how many mansions exist in your school district.
But it all boils down to, Dr. Murray, the whole concept of this systemic racism. You know, what you're talking about is relates to the ACT, the SAT, and the MCAT. That's an elitist type of dealing. You know what I'm saying? I mean, like you said, I can take the ACT and get, when I was in school, get like a 20 and go to college and perform well above that. Maybe I'm just not a good test taker. This is all about money, and it's all about being able to make sure that you classify people in certain classes and the elite level that they have once they get to school. Once you get, like you said, taking the MCAT has nothing to do with what type of doctor you end up at the end of the day. You know, so this is policy. These are things that we should change. When College Board, when students couldn't go take the ACT and they couldn't take the SAT, schools said, you know what, forget it. We won't even take it. We don't even need it. We can take your grade. Then I saw all of these emails and posts and news articles from College Board about how you can't eliminate this. You don't want to eliminate it because it's a moneymaker for you. You don't want to eliminate it because it may actually level the playing ground for a minute and allow some people to have the opportunity that the ACT and the SAT may have stopped. This pandemic has exposed a lot. It has addressed so many inequities within society, education, economics, health, achievement, opportunity. It's opened it all up. You got students on the west side of Chicago that's learning at home that can't even adequately learn because they don't have a good broadband to be able to receive the internet that they need to do their schoolwork. It's crazy.
You know, and let me just jump in here too, because I think those kind of issues that Selena's talking about, really clear resources. 'Cause I think tax policy and real estate segregation and the assessments, the efforts to reform assessments are important, but I think movements to organize people around these real clear resources that people need and children need, like right now, like effective broadband, working laptops and you know, iPads and whatever, that those things are powerful issues that could be that public health champions like us could create allies with around ending structural racism during the pandemic and during people being educated from home, as this debate between CPS and CTU continues to unfold. So that's kind of another important topic area. But I think some of the things that Selena is talking about that's real concrete can really pull people together, and that public health equity champions should rally behind and provide the supportive arguments for. Let me just throw in one item about this structural racism and property tax assessments. One of the things that I've noticed is that a lot of folks who are now real champions of, yes, let's talk about structural racism and racism that goes back 200, 300, 400 years. When it comes to talking about structural racist policies that happened last year or 5 years ago or 10 years ago, they really don't want to talk about that, because that starts to me, in my opinion, that starts to implicate them and their lack of opposition to these policies. And one of those specifics is the transfer. UFC researchers identified that because of the racist assessments, property tax assessments, not the taxes themselves, but the assessments of property values, $4 billion were transferred from communities of color. Was basically $4 billion of taxation was transferred on top of property owners and homeowners in communities of color in Cook County, away from the richest, whitest neighborhoods. $4 billion. So that exacerbated the historical impoverishment based on race, based on all of the books that have been written about redlining and all these historical efforts by banks and folks to do contract buying and all that stuff. That's something that's been real. And I think to connect it with now is Fritz Kagi's effort to reform that. It's not a done deal. The real estate industry is pushing back on that. And I think it's a question of power. And that's something else that we should be on top of.
It's always a question of power, Jim. I mean, policy affects everything within the United States. Everything that we do is dictated and ran by some policy of some sort. So we have to be, when you talk about movement, I'm thinking more so revolution. We have to do what we need to do to make sure that the change takes place and it's going to last. We think about voter suppression, all that people had to go through to be able to vote. We think about the inequities with education, our students not being properly educated so that once they get to the college level, they can be competitive even when applying to college. You talk about health. This pandemic has wiped out so many Black people. The numbers are ridiculous. And 50% of most African-American households, they either know somebody that lost their job as a result of this pandemic, or they lost their job themselves. And I guarantee you, if out of all the Black people that you can name somebody that has died from COVID-19. So we have to, our movement has to be on change in policy, which affects everything. As I've been, my degree is in public administration. So my responsibility is to hold people, politicians and people that are in charge, administrators, accountable. So when policies and things are out there like that don't act in my favor or in the favor of my people, then it's my responsibility to stand up and say something about that. And that's why I'm in public health as a public administrator, because there are changes that need to take effect that won't happen unless we do something.
Yep.
So,
go ahead, Mark.
Go ahead, Doc. I'm gonna ask a question afterwards.
We need to demand what we really need. So, for example, I was talking to some young people the other day, and they didn't know television used to be free. I mean, you had to buy a television, but once you bought a television,
and they were probably in medical school too. So these are the cats that gonna be looking at me. Cats that don't know TV was free.
So they didn't know that back and you might have, like we did, pliers to turn the channel with, but the point is the airways, because the airways belong to the public. You couldn't own the airways until we had some political changes. So why can't the internet be free? I mean, why are we charging people? You have to pay, and then you have to pay extra to get a decent speed. So we have to learn how to say, no, this stuff doesn't belong to XYZ. And I get so furious now in my old age, because not only do I have to pay for cable, but they have nerve to have commercials on it.
So I understand what you're saying. So here's the thing, and I'm gonna pigeonhole all four of us for an example. I'm just for a second. Let's just say this: everything you all are saying is fine, but there's certain things that were out there that were supposed to be allocated for like schools and stuff already. For example, the lottery money was supposed to be earmarked for education.
Right. Yeah.
That marijuana money was supposed to come out. So, for example, let's just do a ghetto little strategy. Let's say, Doc, you the philosopher, Selena, you the policy person, Jim, you're gonna be the white boy that sat by the door. You're just gonna play the role and get in the offices and stuff. Me as a warrior, and some of these young people that are warriors, what can we do specifically to say, hey, politicians, this lottery money was supposed to go here. This marijuana money was supposed to go here. It's not going there. Because we can have simultaneous battles and simultaneous wars as long as we all strategically think about what we need to do. So on that level, and answering Maddie's question, what can we do to put pressure on politicians to get some of this lottery and marijuana money allocated to where it needs to go?
I think the problem is, Marcus, is that nobody has asked the question. You don't hear anybody asking the question. What happened to the lottery money that was supposed to be when the state of Illinois first entertained having a lottery? The one thing that they used to be able to get people to agree to having it was the fact that they said the monies from it, the proceeds from it were going to go towards educating our children. Nobody asks about that now. But the lottery is, people play it every day.
Who do we call? Like, Jim, Doc, do you want, like, who do we call? Should we spread this number out just like the cancel culture puts out stuff on these entertainers? Should we say, hey, call these lottery people, let's get this money for our community?
I think you do. I think, first of all, people lost track of that. A lot of people don't, just like they didn't know TV was free. They didn't know the lottery money was supposed to go. Some of it was supposed to go to education. However, it wasn't all supposed to go, unfortunately. So sometimes we get the shuck and jive, switching bait kind of stuff that goes on. And so the fact is that Illinois isn't funding anyone's education at the level that we're supposed to, that we agreed as a state to fund it at. So it means, yes, I think people should be on social media. They should be, if they want to march in front of somebody's house, they can do that. If they need to vote people out of office, they got to do all of those things.
I think that.
Hold on 1 second, Jim. I gotta say this: the spirits are guiding me, man. We know two sisters that meet with the governor. I don't know them personally, but this is what I'm saying. As Black folks, instead of being happy that you know these two sisters, call them up and say, "Hey, where's that money going?" That's what I mean about putting pressure on people. Nobody should get off that easy. So if you're gonna represent us and be a person of color, you got meetings with the governor, man, say, be a voice for us. Go ahead, Jim. I just wanted to say that. And they know what I'm talking about.
I think your thinking is a lot in terms of who do we know that has relationships with high government officials with power, and to use those relationships and pressure folks and say, so what are you doing? But I also think that once we do that then we've got to take this power approach. We've got to do a power analysis, and we've got to do organizing, do the labor organizing, the people power building, which then helps everybody involved in that learn by doing. So I don't think you lose any fight in organizing, because you stick up for yourself, you challenge the status quo, and you learn by doing, and then you get ready to have a big win at some point down the road. But I really think let me apply that to one thing that I saw. I forced myself to read this full-page ad in the Chicago Tribune, paid for by University of Chicago Hospital, saying health equity is very important to them. And it was fine print. It was like an interview with their health equity director of some kind. And so anytime I see somebody saying like that, what's health equity, especially from a big wealthy hospital, I kind of, say, so how do they define health equity? Well, one thing I noticed was never did they mention the organizing effort that was put on by activists, and many of them young youth organizers, demanding and winning an effective, close by emergency department for their community. That was never mentioned. The word power was never mentioned. They said, so why did you get interested in health equity now? And she just said, well, we realized that we could do better. There was no mention of the Black Lives Matter massive national movement in the streets. And so I guess what I'm saying is, if you look at people who are defending the status quo, to me, I would say, like, what is your it was the racial makeup of folks that you employ in University of Chicago Hospital Health System? Because the national data shows that it's largely women of color. They get the lowest paid jobs, lowest incomes, and are in poverty, and their children as well. And, so they don't talk about that as either. So I guess to me, you've got to take this collective power building approach because my sense was, having just recently stopped working for the Cook County Department of Public Health, is that real power is folks in position of authoritative positional power are often very sensitive to the elected officials above them. And I think many of us could think of ways of instances in which the highest elected officials have told those appointees in public health and those leaders to tone it down. Don't talk about something here, talk about something here. And so I think when you've got groups like SOUL, when you've got things like the People's Budget, that those things they can't be shut up. And I think that's what we need to build, is some of these social movements and work together with organizers.
Well, you got people.
Go ahead, Selena.
You got to have people that's willing to rock the boat. You know what I'm saying? Like, if I know what's right, and we all know someone who was just recently let go because they were willing to rock the boat from a high position within Cook County Health Department. I mean, you have to be willing to stand up for what's right, and sometimes standing up for what's right is not always going to end, in the way that you want it to end in your behalf. You may actually suffer from it, but if you open up your mouth and you say what's right and you act upon it, at the end of the day, the good will come out of it. As public health professionals, we have, just like Marcus said, we got to get out there and approach some of these people and ask some of those hard questions that they don't want to answer and they don't want to hear coming from us. But if we don't ask the questions and if we don't say anything, we're just as bad as they are, because we did nothing.
So I think
I feel it. And I just want to say, for the record, I love Black people. I'm pro-Black. But the Black Lives Matters movement ran by that organization did not speak for me as a Black man in the city of Chicago. So I just want I don't want white America to think that organization represents all Black people. I like the slogan, but that organization doesn't do shit for me.
Wow. I'd love to hear more about that.
I don't think one organization represents all of any group, but I think the key thing, and let me just say, as someone not born and raised in Chicago, at one level, when you talk about who you know and who can influence, we tend to have a transactional approach to power and relationships, and that's not good enough. If we as a community,
what do you mean by that? Break that down for us.
So this is what goes on all too often. Obviously, it's not everybody. So it's like, well, I'm gonna call out people. So the mayor wants votes on her budget, and if you vote for her budget, she'll give you some little pennies for your ward. That's what I mean by transactional. Where people's even if their votes aren't bought with money in their pocket, that happens too, as we know. But even if they're bought for some specific thing in your ward or in your district, that's not good enough if the overall budget, for example, not funding mental health services, harms the community as a general thing. So we tend too often, because it's sort of the Chicago tradition, is like to maneuver around in that respect. What needs to happen, and again, it's not ever going to be monolithic. I want to be realistic, but we can get a consensus. So like Marcus has some concerns about Black Lives Matter, which by the way is not one organization, but that's okay. Black Lives Matter movement. But there's some things on their agenda that he might agree with. So if you can get agreement, we want to fund grammar schools at this level, or whatever the agreement is, then you can force not only the elected officials, start with them, because in theory they work for us, but also institutions. So for example, what I would say to the University of Chicago hospitals, if you're serious about addressing health equity, then pay your goddamn janitors more. Okay, start there. Because if you pay your janitors and people working in dietary and your nurses assistants more money, then their children will be in better shape and will get a better education. That's not the only thing that needs to happen. So we have to learn to connect up these demands together. So we push all together around these issues. We don't have to have 100% agreement.
Who's going to do it though? And I'm gonna tell you, I'm still a young boy, but I've been in this game over 20 years, and a lot of these people, a lot of these Black folks to get in those meetings and have those chances to say that are suckers. They're not saying it. Whether it's not, they don't want to lose their job, they don't feel the fight, they just don't do it. So if we don't have advocates at those levels, we know it's racism out there. We know they don't like us. We know they don't care about employees. On a grassroots level, especially with the power of social media, what can we do? How can we start training these younger folks to pick up this fight for us? You know?
Well, so let's be clear. As someone who has gotten fired before for speaking out,
I just want to say for the record, I forgave Ty Stroger for firing you the last time. Yeah. I was upset with him for a while.
He failed at firing me. He failed at firing me. There were other people.
Ty. I just want to say for the record, I like Ty.
Well, Ty did not fire me, so let me just say that.
I feel the way the Black community turned on Ty. It's sad. Right. You always got a home with me, brothers. Especially your 8th Ward brothers turn their back on you. That's another story. But go ahead, Doc.
Why you bring up these things? So the point I'm trying to make is it's important. It's important that we agree on some basic agenda issues. Okay, it's less important. We're not. A lot of people have this naive notion that we should all agree on everything. That never happens. It doesn't happen within one political party. It doesn't happen within one fraternity or sorority. It doesn't happen in one organization of any type. That's not the point. The point is, are we in motion and fighting for what we believe in? There's some Black people that I completely disagree with, but at least if they're in motion trying to get what they think is right, that's an improvement. So that to me is one kind of goal. And I think that's the organizing that Jim is talking about. But first, you have to sort of be willing to say what the issues are and what the problems are. So most people in this city do not realize how much money has been stolen from especially Black and brown poor communities in the property tax, and let the rich white communities off the hook on property taxes. So we need to spread that information. Most people don't realize that even the little bit of money that was supposed to go to lottery money was supposed to go to education didn't happen, and it should be more. So to me, it means framing our demands in a more conscious way. Why, in the midst of a global pandemic, are we sitting up here without universal medical care? So to me, what I would say, for example, to Biden is in the first 100 days, you ought to pass Medicaid for all if you're serious. Because you got people, and it's not just Black people, you got people all over this country, these people in Iowa that are white rural and voted for Trump, dying like flies from this pandemic. Okay, so we have to be clear about what we need to do in this country.
Yeah, I mean,
and I agree. I think we all should make a list. The only thing I want to get to, I think Selena, Jim, Murray, and Doc Murray could make a list, right? But we have to be able to translate that list to the people, to the fighters, the warriors, and the organizers in the community, where they understand what red line is, where they understand what you're saying, because these are the people taking on the fight every day. So if we're not arming them with the right weapons and tools, if we're just having intellectual conversations and using jargon that we only understand, we're not going to go nowhere. We have to include everybody into this struggle.
And Maddie in the comments, I don't know if you're looking at the comments, is pointing out that if you belong to a union, making sure that union is militant, making sure that you have an anti-racist union, making sure that they're out there in the streets, not just for their members, but for the general field, is another way to exercise. We only have power when we come together in groups.
So
none of us has very much power.
Speaking of that, November 23rd, there may be a strike of, I think, 7 or 11 involving 11 nursing homes organized by SEIU Healthcare, Illinois, Indiana. And they're demanding increase in base pay to just over $15 an hour and pandemic hazard pay. And so this is an opportunity for public health champions in and out of government. I mean, to me, Chicago Department of Public Health, Cook County Department of Public Health should support the struggle of these nursing home workers, if only because when you earn more money, you're healthier, and also they're possibly able to prevent infection in the places where they work. And they're doing, obviously, the heroic work of like many people are doing. So to me, and this is something that, like Linda talked about, saying things in an analysis. And I think this is what's missing. When there's discussions about infection rates and what's going on with nursing homes, I heard it on the radio today. It's like, well, there's shortage of staffing. And then they just stop it. They don't say, why is there shortage of staffing? And they'll say, well, staff needs to earn more money. Well, why is there pay cut? Why aren't they earning money? Some of it has to do with equity investments. These equity companies come in. I did a brief Google search and found that mortality increases in the first 30 days after an equity company buys a nursing home, an equity group buys a nursing home facility. I mean, it's that clear and grotesque. So to me, this struggle is happening like right here, and we should be there, and we could also we can demand that the positional leaders inside of public health support union efforts, and that these hospitals who claim to care for racial equity and health equity, that they should also support efforts for collective bargaining, not only in nursing homes, but in their own institutions.
Well, so the Maddie in the comments is probably my mother, who was a nurse. She's been a nurse for the last 30, almost 40 years. She is a great advocate for her nurses. They are always advocating for the proper PPE equipment, advocating for more money for their nurses. And like you said, they say that the staffing is low, but they never say why. It's an effort for the hospitals to try to save money, but in all actuality, they end up spending more money. You won't pay the nurses that are on staff to actually do the work, but you'll go to a staffing system or service and hire nurses outside and have them come in and do the work that you could very well pay the people that you employed to do. So, hospitals, everybody's in on it. Everybody plays a part. When you I was listening to a broadcast and they were talking about provider bias, with this whole pandemic. And if we could touch on that before it's time for us to get off, I know people are concerned, about the pandemic. I think as public health professionals, we have a responsibility of making sure that the information that's transmitted to the public is clean and unbiased, and they get a clear message, because anything that we hear, can cause fear. It can cause people to panic. Right now in Chicago and pretty much a lot of other states across the country are going back on lockdown. We're on a stay at home for the next 30 days. But I think we need to make sure that the communication is clear. Yes, people are dying in rapid numbers, but there are people who get better and who get well. Right now, there is a blatant medical distrust going on among African American people, because we're talking about how people African Americans are not being tested with the virus, or not going in for to do the trial testing. Rather, I'm not going into for no trial test, because I can't trust it.
I'm not going either.
You know what I'm saying? And I'm gonna let a couple other people go and get the vaccine before I go as well. Because why? I don't trust it. We need to have conversations. There needs to be some town hall meetings that take place, because people need education more than anything, and they need it to come from trusted sources, people where they can say, you know what, if Marcus told me, then I believe what Marcus said, because what Marcus said, because Marcus is typically 100 with me. Those are the kind of conversations that need to take place. If Dr. Mary tells me something, I'm going to take that to my grave, because I know I've never had her to tell me something that wasn't right. So we need to tap into that. Like you all said, we need to create some lists and come up with some strategies. And we need to figure out what we need to send to this administration. I'm going to use my platform with APHA and figure out how we can get some communications across to this new pandemic task force. We need these task force to trickle down into the states so that we can manage this thing better. And like you all said, the children do need to go back to school. But if it's going to hurt them, if it's going to hurt their health, then we need to be strategic and think about how we can maneuver this thing.
Well, that's a perfect example. I don't know if people have been paying attention to this. In some parts of Europe, for example, the schools were able to stay open. But I understand completely. And of course, not being in school causes a lot of harm to our kids. There's no question about that. But I can understand the teachers union's position, because this is a school system that can't keep toilet paper in the schools. The teachers have to go out of their own pocket and buy toilet paper. They don't clean the school. So you can imagine the lack of trust in a school system that says, we're going to open up, and you can't even keep the schools clean normally. So there's something wrong with how we discuss and think about this. And it's too much, the school management and the union needs to be sitting there together. Both of them are supposed to be caring about the children, but they also have to care about the staff, the teachers and the staff. As you know, many other schools in Chicago, the Catholic school system is open. I know Catholic schools where they've had 3, 4, 5 teachers out with COVID. What are they doing? What's going on with that? So again, you can't have trust where you don't have power and equality. I'm going to trust someone else to take care of me when these are the same people that have been beating me for centuries. That doesn't make sense. So trust means you have to work together. So Jim, your wife's a school teacher. What does she think about all this?
Oh, she's really, really concerned about being told at some point down the road that she must report in person to her school. I actually saw yesterday the letter that was sent from CPS to parents and staff. And so she asked me what I thought, and I kind of was reading it in detail. And it was a little troubling because one of the top paragraphs, the line said, based on Chicago data and national data, we know that schools are not a source of big infection. And in a document sent by email, there was a hyperlink, which functions as a footnote. And so I checked it out. Okay, so I'm expecting it to be CDPH, Chicago Department of Public Health Analysis or something. or some journal article or, or something from CDC. And it wasn't. It was a link to an NPR story of early October. So I'm like, wait a minute. And then I looked at the NPR story and I'm like, okay, maybe there's something here that talks about Chicago data. And it wasn't. It was international. It was analysis and of peer-reviewed journal articles about international topic of schools. So, I mean, I looked at the CDPH site before we came on, and right now, percent positivity is 20.8% of people aged 0 to 17. That's up more than 1% from last week. So, I mean, that's a very high positivity rate. So, I mean, I think that, so there was something on WBEZ this morning. They were saying, like, this doesn't make sense. The governor's saying stay at home now voluntarily so that we don't have to make a mandatory lockdown. Why would they be doing this? And, because
they don't care, Jim. That's why.
But it doesn't make any sense. And to me, where is your Chicago Department of Public Health data? Where's the CDPH in supporting or not supporting this policy?
Even deeper, even on a simple level. Don't we have a black woman that had a CPS now? What's her name?
Dr. Jackson.
Janice
and we got a black female mayor, right?
That's correct.
And all the rates are going up. And we know the South Side CPS schools in poor communities are nasty, and that we already went through that. So who is this going to affect mostly? It's going to affect us. So
Marcus,
at some point,
closed.
Right. At some point, we got
as adult children, as a young adult.
That's what I'm saying. So
was right. So you're gonna look at little kids and expect that they're gonna keep their mask on all day,
right,
and they're not gonna talk to each other.
The school is clean, and it's already messed up anyway. So at some point, we can't. Jim could do it. He could go to his community and yell and scream at the white folks. At some point, we need to question the decision making of both the mayor and old girl. So let me say this, Doc. This Chicago, so the black people that's happy to say, "Ooh, I know the mayor." Call her ass at home and start asking her these questions instead of being happy you got invited to the mayor's ball or Stephanie, your neighbor, and she had on a cute dress or something. Because hold on, last 30 seconds, and I'm gonna let you go. I've seen the strength and the power in black women throughout the years. Black women are the closest thing to God. We ain't gonna go into history. I've seen these black women go to these Trump supporters, handle their business. Now, I wish it was more black men out there to protect them. So if we start utilizing black women on the grassroots level, some of these parents, some of these teachers, and have them talk and give them the equipment, the words they need to approach some of these leaders, man, we'll make a difference, man. For real. I love sisters, and we need to support them and help them. Not always the ones running for office. We need to support some of them that work too.
That's right. So let me just say as we get to time to close, I wish everything were simple. Open schools, closed schools. It's not simple. And we are an intelligent people, and people can understand nuance. So if you have a couple of school-age kids and you got to go to work every day, then having the schools closed really harms you. We know that our kids will slip further behind. So there's certainly negative things with closing the schools. If we're going to open the schools, we need to do it in a safe way. And I agree with everybody that, like I said earlier, that there's a lack of trust in CPS doing it safely. But what we have to get people to understand is this is a risky decision either way. And we have to discuss it openly as a community and come to some conclusion of what we're going to do. I give my discussion now. Let me finish. So, for example, and I'm not defending anybody's decision, but for example, as I understand it, I could be wrong. CPS is talking about offering in-person classes for students with special needs and the very young. For example, for different reasons. So what I'm trying to say is we need to be having all of those discussions. There were a lot of people up in arms because football couldn't go on, but we didn't have a discussion about what that meant, or so having schools remotely or not impacts different kinds of students different ways. What we need to do is insist that we do the best we can for our children. We have a global pandemic, so we can't keep everybody completely safe. That ain't happening. Not because the country is ignoring the pandemic, So now we have Iowa has a 40% positivity rate in the state of Iowa. So, and they're right next door to Illinois. So what we need to do, if we're going to decrease how many people die from this pandemic, how many Black people die from this pandemic, we've got to learn what we can about the pandemic. We have to discuss the advantages and disadvantages about whatever tactic we do. And then we have to be willing to stand up and fight for the course that we think is best. But that's not going to happen if we're not paying attention to what the details are, and if we don't have CTU sitting down at the same table with
Yes.
Well, I think they did sit down. They did sit down, and there was what do you call it, an arbitration, and CPS, my understanding is, blew off the arbitrator's recommendation. That was around.
I support CTU at this point. Let me be clear. I support CTU at this point because they would like to, if possible, get some kids back, but they want it done safely. So I agree with CTU's position. But what I'm trying to say is, as a people, because what we're doing here in Chicago may be different than what's going on in Detroit or Pittsburgh. What I'm saying is, as Black people, we have to understand what's going on with this pandemic and ask ourselves, what do we need to do to save as many lives as possible?
Yeah. And they understand, they just don't have a voice. So as we get ready to close out, I just want to say this is the choice for cats in the hood. Little Johnny doesn't go to school and falls behind in a racist ass society, but little Johnny goes to school and comes back and has the chance of killing Nana and the rest of us with COVID. So that's a messed up decision.
It is.
But as we close out the show, I just want to go around this, Selena and Jim, and ask if they have any last. First, I want to thank you all for being on. I really had fun. But to see if you all had any last comments that you want to say. Selena?
Well, thank you all for having me. I just wanted to comment on what you just said about little Johnny not going to school and falling behind. That's where I've been pushing the administrators and the people where I work, for some of the K through 12 programs that we have, because it's a fact that there are going to be some students that are going to fall behind, and we need to be prepared as university administrators, people that believe in No Child Left Behind, to make sure that we are there to give that extracurricular learning, or that the comprehensive learning that the students need away from school. So when we have our summer programs and our Saturday enrichment, those enrichment programs that help the students get up to speed or give them what they need, that's going to rely on us. I would rather Johnny have to come to an enrichment program and catch up than Johnny give Nana COVID and we not know if Nana's going to make it through. I mean, that's just my perspective.
So, I want to give a plug first for a book called Emergent Strategy, which actually is kind of a leadership book, but it's a radical, different take, which I've never heard of at UIC DRPH program in leadership. It's called Emergent Strategy. It's only a couple years old. I'm just starting that, and I think it's got some good. I'm excited about it from what I'm seeing. But I want to end by saying that public health is not neutral. Public health cannot be neutral when it comes to oppression and racial injustice and exploitation and structural oppression. True public health means that you take sides on the side of people who are dying sooner, working harder, contributing more, and getting sicker because of undemocratic attacks on democracy. And there's nothing short of what we're going through right now, despite our victory with Biden. We're going to continue to have these attacks on democracy, and we've got to strengthen Black voices, people of color's voices, indigenous peoples, so that there's a future that we could call, human. So public health must reckon with these existing structural oppressive forces, and they should not be a part of it.
Doc?
Well, remember, while people died for our right to vote, voting alone ain't never made us free. We're not free yet, and freedom's a constant struggle. So those of you that voted November 3rd or earlier, great. And for everybody, the work is just beginning with this new administration. We are faced with a major threat to our lives with COVID-19. This could set us back decades in our ability to function in this country. So it means all of us have to be alert, and we have to be willing to be out there in the streets, in the courts, in the boardrooms, wherever we are, to fight for our people.
Yes. And I need to give a quick plug too. Tomorrow at 6:30, we'll be having Black men on that provide services to Black men, talking about community engagement and research. 6:30 tomorrow, same channel, same everything. And I just want to leave with this too as a funny thing. I meant to say this earlier. It's quite amusing for me to see white folks arguing with each other. It reminded me of like some folks and brothers, some Crips and Blood shit, with the white people arguing about Trump, the liberal whites and the Republicans. So that was a little humorous. But we all have to fight, even though I'm pro-Black. I want people to understand I'm pro-Black. I believe it's a strategic thing. We all need to join forces and fight. As Black folks, we just need to step up and take care of each other first. And COVID is real. The numbers are going up. Hospitals are being stressed. We're having a nurses shortage, everything. Would you like to add 30 more seconds about COVID, Doc? Because I think this is important. People don't understand the seriousness of it.
It's critical, and it's easier to catch now than it used to be, not because the virus has changed, but because there's more of it around in the population. Please do not go visit each other for Thanksgiving. Stay home as much as you can, and wear your mask at all times, and keep an eye on these politicians and public health officials, and insist that we do what's necessary to bring this pandemic under control.
And we need to fight for Mercy Hospital, y'all. You know they're trying to close that hospital down.
That's sad. All right, well, thanks for tuning in to another episode of Everything is Public Health, sponsored by Young Health Professionals. We'll see you in December. Be safe. And hopefully, after this bye week, go Bears.
Hey, thank you so much. I really enjoyed being here. Thank you.
No problem.
Take care.
Bye-bye.